cover obtaining a health history, how to obtain a health history, and the components to obtaining a health history. So first of all, you want to get comfortable talking because that's how you perform an interview. You're going to want to talk to your patient. You want to be comfortable asking deep, meaningful questions, and by deep, meaningful questions, I mean open-ended questions that are going to allow you to gain information necessary. So, phases to the interview process. The first stage is the introduction phase, which is where you will want to set your expectations as a nurse. You'll want to stand your ground, such as, this is what I'm here for. I'm your nurse. We're here to talk about you. I need information from you for your own good. And the discussion phase, you want to keep your discussion patient-centered. So if the patient starts getting a little off topic, talking about things that don't really pertain to them, you want to redirect them back into the right path. This is where you'll talk about family life, past hospitalizations, surgeries, their marital status, date of birth, etc. And like I said, you want to ask open-ended questions, such as, tell me about your life. Do you enjoy your job? Tell me more about what you do for a living. Things like that. And the summary phase, which is where you're going to want to regurgitate the information given to you back to the patient in order to confirm and clarify what they've just said to you and make sure you heard them correctly. As a nurse, communication skills are super, super important, whether it be communicating with your work staff or your coworkers or communicating with your patient. Things to take into consideration when you're performing your interview are your communication skills. For example, you're not going to want to talk to a 15-year-old young lady the same way that you may talk to a 70-year-old man. Obviously, there's a big difference there. Understand and adapt to your patient. Another thing to take into consideration is the physical setting. Always make sure the physical setting is appropriate for you and your patient. Rearrange your physical setting if necessary to adapt. Maybe there's a table in the way. You want to make sure nothing is standing between you and the patient, so that way they know that you're engaging and listening. Maybe the room is too loud. Maybe you would want to ask family members to leave the room, especially if you're going to be asking personal things. Close the curtain and maybe shut the door if the outside noise is too loud. Make sure you're always utilizing professional behavior when you walk into a patient's room. Don't look a hot mess and maybe smile and act friendly. Make sure the patient knows that you're actively listening and engaging with them. Always take patient variables into consideration when performing an interview. The interview is always tailored to a particular situation. So if the patient seems to be in an extreme amount of pain, or if it's an emergency situation, you're probably going to want to postpone the interview. The questions you're going to want to ask the most are open-ended questions, and these are questions that require more than 1 or 2 word responses, and these are the types of questions that you will gather the most information from. Closed-ended questions are sometimes unavoidable, and these are only 1 to 2 word responses like yes or no. Some communication techniques that you're going to want to utilize is 1, active listening. Actively engage with your patient and pay attention to your body language, your nonverbal expressions, your facial expressions. For example, if a patient tells you something rather surprising or disgusting, don't act judgmental, don't look disgusted, because this will cause the patient to shut up real quick. Facilitation. Facilitate conversation. Don't let it end until you feel as though you and your patient have exchanged enough information. Continue talking by asking open-ended questions, requesting more details, drag information out of them. They're not always going to want to easily talk to you, so this is really important. Clarification. Regurgitate the information back to the patient to make sure you understood it correctly, which kind of goes along with restating. Confirm your interpretation. Make sure that you understood everything that they told you in the correct manner. And summarizing, condensing the conversation and make sure you have all your ducks in a row. When communicating with patients or with anybody, there can be communication barriers, such as use of medical terminology. Not everybody's a nurse, not everybody's a doctor, not everybody studies a medical journal. So stay away from medical jargon. when you are talking to a patient. Passing judgment is for sure, nobody's going to want to talk to somebody who's judging them and give them personal information. Interruptions, so if there is a crazy mother or crazy family member or just anybody in the room who is being loud and interruptive, you may want to ask them to leave the room. There are a few different types of health history: comprehensive, problem-based, and episodic, and we talked about these in my introduction to health assessment video, but I'll just briefly go over them again. So comprehensive is an assessment of everything upon arrival to a doctor's office or hospital admission. Problem-based is based around a specific issue, such as a sore throat. You're only going to want to assess the sore throat and pertinent findings. And episodic is a follow-up, maybe a post-op follow-up or a follow-up after a specific diagnosis. There are 7 components of a health history. 1 is biographical data, 2 is your chief complaint, 3 is the history of present illness, 4 is present health status or past medical history, 5 is family history, 6 is personal, social, and psychosocial status, and 7 is the review of symptoms. Going back to biographical data, this includes name, gender, address, telephone number, email address, birth date, birthplace, which is especially important if they were born in a foreign country, marital status, religion, race, ethnicity, occupation, contact person, such as your emergency contact, and source of data. When you're doing history of present illness, there's a little abbreviation that makes things easier to remember to ask, and this is old carts, OLDCARTS. The O stands for onset. When did your symptoms begin? And L, location. Where on your body does it hurt? Or where on your body are you having this rash? D, duration. So say if it's a cough, do you cough all the time or do you just cough here and there? Or do you cough for hours at a time, or is it just 1 or 2 coughs every so often? C is for characteristics. So if you do have a cough, is there any sputum coming up with your cough? Is your cough dry or wet? If you do have sputum, what color is it? Is it thick? What is the consistency? A, aggravating and alleviating factors, and these are factors such as, is there anything that makes your cough worse? Or is there anything that makes your cough better? R, related symptoms. Do you also have a sore throat with your cough? Are your ears bothering you? Do you have a runny nose? And T, treatments. This is the discussion of treatment potentials and if there's anything at home that they've been trying. And S stands for severity. So, how bad is this cough? Old carts basically just breaks down why the patient is there and gives more information on their issue so that it can be treated properly. As sort of mentioned before, there are age-related factors when it comes to discussing health history with your patient. For pediatric patients, you're going to want to ask about the parents' health and the relationships that they have with their parents. Ask about the parents' social support system, just so do they have other family backing them up when they need help. With adolescents, you're going to want to talk to them alone. Adolescents are very, very hesitant to discuss personal things with you when their parents are lurking over their shoulder. With older adults, you'll want to ask about their functional status. Can they still take care of themselves? Do they live with anybody or do they live alone? And their social support system. So do they have a family that can support them in their time of need? That concludes my video for today. I hope you found it useful and beneficial, and if you have any questions, leave them in the comments below.